I was told I had mild cognitive impairment. That didn't sound so bad. As I was crossing the car park, I met the original nurse who had assessed me, who apologised for not being with me for the diagnosis. I told her I was fine and thanked her. And again she apologised. And in that moment I realised that either I hadn't heard something or something hadn't been said. And I asked her straight out, "Are you telling me I have Alzheimer's?" And the answer was yes.
My mum Kate wasn't told that she had dementia because in her case it wasn't clear cut and it was difficult to diagnose. When I first spoke to the public health nurse, I was told that I couldn't get any services until my mum was diagnosed clearly. That was a severe blow, and I remember thinking we were on our own here.
As a healthcare professional, sometimes it can be extremely difficult to disclose a diagnosis of dementia to a patient. Sometimes you're just not confident about making the diagnosis, and sometimes it simply isn't clear who should be disclosing the diagnosis. Is it the GP? Is it the geriatrician? Is it the psychogeriatrician? Or perhaps it's the neurologist?
I wasn't surprised when I got my diagnosis, because for a long time I knew something was wrong. The doctor said there's a little bit of dementia there. And even though I didn't know much about the condition, I knew it was more than a little.
My mum Nora was diagnosed with a rare form of dementia called posterior cortical atrophy after years of tests. So in a way, it was a relief for her and for us to get the diagnosis. But then we were just given a one-page sheet and we left the hospital that day with no idea where to turn for support.
So as a community-based healthcare professional, there is support out there for you too. The Dementia Pathways website is a resource that helps you after the diagnosis of dementia is made to guide and support patients and their families.
Because my father also had Alzheimer's disease and I recognised the early signs, and that's probably why I deferred going to the doctor for a few years. When I finally did go to see a GP, they weren't sure of a positive diagnosis, so I decided to go directly to a memory clinic, and I was given excellent care and attention there.
Even though it was heartbreaking to hear those words, I would have preferred to have been told straight out that I had dementia. For me, not using the word gives it more power and adds to the stigma that we are trying to fight against.
In many cases, you may have a long-standing relationship with the patient and their family, and oftentimes you're really concerned about how the diagnosis might impact upon them.
Families need information as to where they can go for support, and we feel that no one should leave the doctor's office or hospital without the Alzheimer's Society helpline number and information about other supports out there.
For us, receiving a diagnosis is not the end of a journey, it's the beginning. And you can make a huge difference to how that journey begins.
Please visit our websites